Hi there, I'm Janelle Thompson, family nurse practitioner, and welcome to another episode of What the Health. So last week we talked about tension headaches, and this week we're going to talk about migraine headaches. So the location of a migraine headache, more commonly, about 2/3 of the time, is just on one side of the head. The migraine headache tends to come on gradually, but it does build and oftentimes can last anywhere from 4 hours up to 72 hours if it's left untreated. The quality of the discomfort of a migraine headache tends to be a pounding, throbbing sensation of the head. Now, some people just prior to the migraine have what's called an aura, a sensation, almost a premonition or a neurological symptom that lets them know that the headache is going to happen before the pain even begins. So this could be visual changes, numbness or tingling in the face or in the extremities. It could be loss of feeling completely in an area of the body. There could be hypersensitivity to lights in a room, to noises. Some people see visual floaters in the periphery. For people who get migraines more commonly, they learn very quickly that if those symptoms are beginning, that a migraine will come next, and that's when they generally take their medication to prevent that. Migraine headaches can lead people to be very sensitive to light, sensitive to noise, sensitive to movement. Daily activities with a migraine headache tends to make that worse. Usually the first thing that people are doing with a migraine headache is they're looking for a dark room, a quiet space, somewhere to lay down and not move. Medications for first-line treatments that people can use at home would be the nonsteroidal anti-inflammatory medications such as ibuprofen, naproxen, or even medication like acetaminophen, which the brand name's Tylenol. From there are also prescription medications that if you've been diagnosed with migraine headaches, they can be used to be taken right away and halt the migraine from continuing on. The goal really is to try to enable the patient to take care of the migraine headache if they can at home and not have to go into the emergency department or the urgent care or walk-in clinic every time that the migraine happens. It is important to note that when any medication is used to treat a headache, that you want to make sure that you're not using the medication so frequently that it leads to what is called a medication overuse headache. If we're taking any type of medication for pain too frequently, it can trick the receptors in our body to not recognizing pain like it used to, and we can actually continue to have headaches in response to taking the medication. Additionally, with migraine headaches, if somebody is getting migraine headaches frequently, there is medicine that can be prescribed by your family provider that would make you not have migraines as often, and that would be more of a suppressive type medication or a preventive type medication. So there are plenty of treatment options available, but with migraine headaches, the first step is really to be evaluated, have a good diagnosis, and know why these headaches are happening and if indeed it is a migraine. Thank you for joining me for another episode of What the Health, and I'll see you again next week.